So I'm going to give you a short introduction on the Simeox technology. So everything starts from obviously the patient and their quality of life. And as you all know, patients with chronic pulmonary disease is significantly impacted and their quality of life is significantly impacted. And still today, some of those pain points that you are all dealing with on a daily basis are very difficult to address, like dyspnea and fatigue due to hyperinflation, sticky and viscous mucus, which is very hard to mobilize in those diseases, which as a consequence will favor infections. And we all know as well that bronchial drainage is something that is utilized today to address this, which is very demanding for the patient and very much time-consuming. So in this context, PhysioAssist is coming on the market with this innovation, so very new technology, unique technology, to assist patients suffering from chronic pulmonary disease, to help them clear abundant and sticky mucus, and with the final goal to restore the comfort of breathing. So this device targets primarily CF patients, COPD patients as well, and bronchiectasis. And what is very interesting is that this technology is really the results of years of research on physical properties of the bronchial mucus. And we have partnered with the National French Research Center for 5 years. And the design of the device is really the result of this partnership. And I'm going to take you through rapidly the different steps of the research. The very first step is, has confirmed that the bronchial mucus has a thixotropic property, meaning that if it's stimulated with the right, a very specific signal, it can liquefy like water in less than 2 seconds. But we also have shown and demonstrated that if you stop, as soon as you stop the stimulation, it goes back to its initial position as quickly, in less than 2 seconds as well. So the conclusion is that stimulating and vibrating the mucus is great, but it has to be done with a very, very specific signal, and also it has to be transported at the same time. The second step has been the definition of this signal. What is this signal in terms of frequency, shape of the signal, power, quality of the signal, so that this signal that specifically liquefy the mucus has been also defined with the research. And lastly, the third step, we have developed, so with the National French Research Center, a numerical lung model in order to validate this signal. And this numerical lung model has allowed us to, so we have injected the signal in this model, and we have validated that this signal can disseminate until the very last generation of the bronchial tree. So we can really go deep in the lung in order to do distal bronchial drainage. So some of the conclusions, so the mucus can be liquefied like water, but it has to be stimulated with the very specific signal. The signal has to be applied during the exhalation, during the whole exhalation phase, and we can transport the signal from the very distal part of the lung to the central airways. So this is basically this signal that is delivered by the Simeox devices. So how it works, so the patient will inspire by himself, and then when he's ready to release his breath, he will trigger the signal from the device, and the device will send this specific signal. So you have an illustration, so the mucus, and then the signal is disseminated in the bronchi, liquefying the mucus and transporting the mucus at the same time. So what we do, we apply a series of points of depression with the right signal that will liquefy and transport the mucus, that creates this wave that brings the mucus from the distal part of the lung tree to the central airways. The very specificity of the device, and this is something that also explains why the technology, why we have so great outcomes with the technology, is that we apply short pressure depression, points of depressions, and we do this because to avoid the bronchial collapses. We know that chronic pulmonary disease, we have very unstable bronchi, and if we apply continuous flow, like other type of techniques or devices do, then it will lead to the collapses of the bronchi, so we won't be efficient in terms of bronchial clearance. So by applying those point depression, we avoid the bronchial collapses, and during the exhalation, the patient is actually connected 70% of the time to atmospheric pressure. So in order to conclude some of the key benefits, so Simeox is definitely an innovation in terms of respiratory care management for the chronic pulmonary diseases, and really helps to liquefy and transport the bronchial mucus from the distal part of the lung tree to the central airways. There's no collapsus of the bronchi, and we know it's a major issue with those patients, but we do not ensure the collapsus of the bronchi. We also see from experience and from feedback from users and patients that it helps, it can very most likely help to decrease the hyperinflation, so this is something we need to investigate more from a clinical perspective. And another point that is also obviously also very important is that the patient remains passive. The patient uses the device in total relaxation, and his fatigability is not increased, which is a major also benefit from the device. Thank you.